overnight in a hospital? All data suggests that in a given year, only about 1 in 10 of us do. It's not a universal experience. Could you sleep in a hospital? With constant noise, with sharing a room with strangers, perhaps, with contemplating mortality, and more immediately, the fog of germs in the place, with staph infections and MRSA, and nursing staffs cut to the minimum, and overworked doctors, and medical record keeping so primitive, it might as well be done on blackboards. And the bills? What about the person who is sick and the bills? How are they supposed to get better while they are sitting there inside a giant cash register? How do you heal? How do you kill a cancer when the meter is running so loudly you can hear it? When a system of healthcare has been so refined, so perfected as to find a way to charge for almost everything and to reimburse for almost nothing, how does the person who is sick not worry always about where he is going to get the money? And how is somebody worrying always about where he is going to get the money supposed to also get better? Yet our neighbor in that hospital bed, hoping tonight half for health and half for the money to pay for it, is still in better shape than at least 122 Americans who might be watching this right now and who will not be with us tomorrow because they will die because they do not have insurance. I will pick it up there and then move on to the question of whether, if health care is not reformed, we should force the issue by bailing out of this stylized blackmail that is insurance. Sometime around 1 o'clock in the morning on Saturday, the 22nd of August of this year, my father, struggling with knee problems, some generalized weakness, lack of appetite, and lethargy, tried to use the portable urinal he kept by his bed to limit those middle-of-the-night trips to the toilet. Sounds a little gross, I know. But certainly not when the alternative is a 10 or 20-minute ordeal of struggling to the bathroom and wondering what in the hell you're going to do if you don't make it there in time. But that night there was an additional problem. He was having trouble going. He tried to adjust his position sitting on the edge of the bed, and suddenly the mattress shifted underneath him and deposited him gently on the floor. He might have been in nothing more threatening than a seated position there. But with his knees as bad as they are, there was almost no chance he was going to get out of it without help. For reasons that would later become apparent, my father would pretend to himself that that wasn't true. He decided to believe that he would soon be feeling better and would be able to get up on his own. He thinks he dozed much of the night. As it got light out, he realized his cell phone was within grasp, and he called me. Not to say he was in trouble, never mentioned it, but only about the move we were planning for him to his own place closer to me. He never mentioned the precariousness of his position. He'd now been stuck on the floor for about 7 hours. Sometime in the afternoon, between the dehydration and the exhaustion, the hallucinations started. He heard my sister and her family in the hallway outside his bedroom. He could feel the vibration of the footsteps of his grandkids running up and down. In a startling tribute to the imagination's ability to make a hallucination like this one completely self-contained and impervious to logic, he heard his daughter say, "Don't bother Grandpa, he's resting." He thinks he smelled cooking. My sister and her kids were, in fact, in upstate New York at the time. My dad found himself increasingly angry, and finally, sometime after midnight on the morning of Sunday, August 23rd, he phoned her and demanded to know why she had been in the house, without so much as giving him the courtesy of peeking her head in to see if he was all right. Only after her repeated insistences that she had been and was 330 miles away and had been all day did reality regain control. My father apologized. My sister called the neighbor. The neighbor called the cops. There was never an official diagnosis of just that one incident that night, but I've gone into such excruciating detail because of what I was told that night by the doctors at the ER at which I joined my father, and what I have been told by other health professionals since. The hallucinations almost certainly were provoked by dehydration, and if not renal failure per se, then certainly a kind of temporary shutdown of the kidneys. By the time he got there, it had been more than 24 hours since he had triggered this cascade of problems by trying to adjust the position of his body so he could urinate. And still he had not done so. My father's kidneys were in trouble. Considering that kidney disease was what killed his father, this was very bad news. We heard just yesterday about kidneys and insurance. The Waddington brothers, Travis of New York, Michael of Santa Fe, as the New York Times reported, their dad, David, needed a kidney transplant because of congenital renal disease. Each of the sons was ready to donate, of course, but they were warned not even to get tested to see if they matched, for if they did, transplant or no, they would conceivably be denied insurance for the rest of their lives. because they might test positive for the same congenital renal disease that threatened their father, and thus they would have a pre-existing condition. And still, the Waddingtons and their dad, and my dad, were all luckier than at least 45,000 Americans. Because as discovered in a new study conducted by Harvard University and the Cambridge Health Alliance, that's how many of us are dying each year because we don't have insurance. The number is horrible. But when it's contrasted to what faced my father that night, it is unforgivable. Because as Cambridge's summary of the findings put it, deaths associated with lack of health insurance now exceed those caused by many common killers, such as kidney disease. My father had less to fear that night from bad kidneys than he would have if he hadn't had insurance. And yet we let this continue. You and I, this society, our country, Democrats and Republicans. This is the study that congressman from Florida quoted, about which the Republicans demanded an apology when they should have been standing there shrieking, demanding that we fix this. Uninsured working-age Americans have a 40% higher risk of death than their privately insured counterparts. People, in short, are dying for lack of money. Dying as surely as they did when Charles Dickens wrote about the exact same problem. A boy who couldn't get sufficient medical care for his affliction, of the underprivileged suffering not just privation but death as the comfortable moved silently and unseeingly through the streets of London. The book was called A Christmas Carol, and the boy Dickens imagined was called Tiny Tim, and it was published on the 19th of December, 1843. And it is 166 years later, and the problem is not only still with us, it is getting worse. The mortality rate among Americans under the age of 65 who are uninsured is 40% higher than those with insurance. In 1993, a similar study found the difference was only 25%. We are moving backwards. We are letting people die because they do not have insurance. What's worse is that barring meaningful health care reform now, this will only grow. The difference between the surveys from 1993 and now suggest this fatal insurance gap is growing by about 1% per year. Your chances of dying because you don't have insurance are now 40% higher than those who have it. By extrapolation, 3 years from now, your chances will be 43% higher. Your chances of dying because you used to smoke, compared to those who never smoked, are only 42% higher. You heard that right. At the current rate, in 2012, you will be more fortunate, more secure, more long-lived if you used to smoke than if you don't have insurance. It is mind-boggling and mindless. This is the country you want? This is the country you will accept? Do those other people in this country have meaning to you? Or are they just extras in your movies, backgrounds in your painting, choruses in your solo? Without access to insurance for all of us, and the only way we get it is with the government supplying the gaps, just like it does in flood insurance, for God's sake. That fatal gap will just keep growing. A 45% higher likelihood of death for the uninsured compared to the insured by 2014. By 2022, the figure will be 53% higher. 53%! In the 1840s, as Dickens wrote A Christmas Carol, in a time at which we now look back with horror, the city of Manchester in England commissioned a crude study of mortality among its residents. A Dr. P.N. Holland categorized the sanitary conditions of the houses and the streets of Manchester into 3 classes. And when he compared the death rate in the first-class houses in the first-class streets to the death rate in the second-class houses in the third-class streets, he found mortality in those worst locations was 53% higher. If we do not reverse this trend, in 14 years' time, we will not be living in the America of 2022. The shadows of the things that may be tell us that we will instead be living in an insurance-driven version of the Dickensian England of 1843. Again. God bless us, everyone. Tonight's special comment continues after this. I told my father the other night that the insurance I really want to get for him and me is called corporate-owned life insurance. C-O-L-I. Coli. Like an E. coli. How fitting. With or without your consent, your employer is permitted by law to take out life insurance on you. It can, in fact, take out life insurance on everybody who works for it. Who gets the money when you all die? Your employer does. Dad pointed out that theoretically this would give them motivation to kill you. That, of course, would be for the same reason, as Michael Moore points out in his new movie Capitalism, a Love Story, that you can't buy fire insurance on the house of the guy who lives next door to you. Golly gee, that's right, suddenly you'd have a motive to burn down his house, and the world is already too much like that